Nothing to see here, just a normal country doing totally normal things in the wake of a tragedy. Las Vegas officials set up GoFundMe to aid shooting victims. The price of no universal health care. So this is from Zaid Jilani of The Intercept. I believe the headline says it all. But he continues here. Last night, a Las Vegas gunman killed over 50 people and injured hundreds in the worst mass shooting in modern American history. The hundreds wounded are being tended to in Clark County's network of hospitals in Nevada. But because this is a country that has never had guaranteed universal health care, they will soon be besieged by a second tragedy, enormous medical bills. This morning, Clark County Commission Chair Steve Sisolak set up a GoFundMe, a private crowdfunding platform to request charity for those injured in the massacre. Sisolak, who is running for governor as a Democrat, pitched in $10,000 and explained that he is currently at the country's Level 1 trauma center with victims. I'm Steve Sisolak, Clark County Commission Chair from Las Vegas. We are raising funds to assist the victims of the tragic Las Vegas shooting. I am at Clark County's only Level 1 trauma center with the victims and their families as we speak. Funds will be used to provide relief and financial support to the victims and families of the horrific Las Vegas mass shooting. Nevada's Republican Governor Brian Sandoval vetoed legislation over the summer that would have allowed Nevadans to buy into the state's Medicaid program. Of course, we covered that story. Asking strangers for charitable donations to tackle medical bills is ubiquitous in the United States. A report by NerdWallet released in 2015 found that $930 million of the $2 billion raised by GoFundMe since its 2010 launch have been related to medical bills. Nearly half the money is for medical bills on crowdfunding sites. Yet NerdWallet's comprehensive survey of crowdfunding sites found that barely 1 in 10 medical campaigns raised the full amount they asked for. Contrast this American experience with that of some of our allies. In June, dozens of people were injured and 8 people were killed when London terrorists ran a van through a crowd and then proceeded to stab multiple people. It was the second major terror attack of the year, the first one being in March in Manchester. In the United Kingdom, most health care is free. The National Health Service, erected in the ashes of World War II, provides comprehensive health care to all British residents. At the London attack, NHS staff were on the scene within 6 minutes aiding the injured. Last month, the NHS gave a special honor to the first responders, nurses, and doctors who aided the victims of the London terror attack. Quote, they highlighted the resilience and the compassion of the NHS staff, who time after time responded to victims who had suffered unimaginable injuries, putting the needs of the people first. This is the NHS at its best, Jane Cummings, Chief Nursing Officer of the NHS, said. In the Manchester attack, American Kurt Cochran was killed. His wife, Melissa Cochran, returned to the U.S. with the need for continuous care. With no American NHS, she had to set up a GoFundMe to finance her treatment. Thankfully, this one both met and exceeded its goal, having raised $83,512. It's the price of a free market approach to healthcare. You know, you would think that this story, just the basic facts of this story, would be enough to make people go, oh, whoa, we need to change this. But we have a problem in the United States, namely the mainstream media. They rarely, if ever, give you context and perspective on our system compared to other developed countries and their systems. So we've discussed it before. Vacation time is another example where you have paid time off by law. Other modern nations, 25 days, 30 days. It's almost like they get their own mini summer vacation. But here we have 0 paid vacation days by law. Paid maternity leave by law. In the U.S., we have 0 days. The only other countries in the world, so not just developed countries, the only other countries in the world that have no paid maternity leave, Oman and Papua New Guinea. How sad is that? I mean, that really is beyond pathetic. And then when it comes to healthcare, here you go. After a massacre, there's a question as to whether or not the people who survived are going to be able to afford their medical bills. And you have to have a public official set up a GoFundMe page to try to help them out. How degrading is that? It really drives me crazy. And then you look at, after 9/11, the first responders. Think about that. The heroes who came out to save people in the midst of the worst tragedy in American history. Then there was a question as to whether or not they're going to get their health care. It took Jon Stewart going on his show and highlighting the plight and the struggles of these people who had horrendous health issues and couldn't afford it. The first responders, he had them on his show and basically shamed Congress into passing the bill that would fund their health care. They had already not passed it. It failed. And then Jon Stewart highlighted the fact that it failed, showed these people who were the first responders who were struggling, who had different rare forms of cancer and were coughing, had huge lung issues and breathing issues, highlighted the story, and then it got through. So Jon Stewart did a better job than the fucking mainstream media, a comedy show. Took a break from comedy to discuss the most serious of issues, and it got change in the country. And then, by the way, there was a sunset provision on that. Of course, there's a sunset provision on the funding of healthcare for first responders. And then it was a struggle to get it re-upped. And here you go. Now you have an example, the worst mass shooting in U.S. history, 59 people dead at this point that I'm talking to you, over 500 people injured, 515, I think, to be exact. Just an absolute slaughter, a bloodbath. Many people dead. But of the people who are injured, they need a GoFundMe to afford the bills. Meanwhile, the program for the F-35-2, the new fighter jet, because, the old ones aren't good enough. The program for the new fighter jet costs over $1 trillion. In fact, I think it's over $1.5 trillion. We had $7 trillion to fight an unnecessary offensive war in Iraq. We have $80 billion a year to give to the big banks as a corporate welfare check, as a subsidy. So when it comes to bailing out Wall Street, blank check. When it comes to money for the military-industrial complex, blank check. They just passed a $700 billion military budget, which makes it as high as it was during the height of the war on terror, when we're balls deep in Iraq and Afghanistan. Nobody said a goddamn word about fiscal responsibility. But when it comes to health care for people who were slaughtered in a mass shooting in the U.S., there's not even a policy discussion about whether or not they could have their health care funded for them. Nobody's even discussing it. No politician, this guy's a local politician or a state politician. Sure, he's, okay, I'm going to launch a GoFundMe. But there's no federal politician who's like, you know what, let's try to pass a bill to fund their health insurance or their health care. Doesn't happen. Look at our priorities in this country. And the most maddening part of it all is, it's not like, the arguments I'm making are arguments that don't resonate. Virtually everybody listening to this right now, and everybody across the country, whether they're Democratic, Independent, or Republican, they're like, yeah, I agree with that. Let's fund that. But we don't get it. Because our government is totally disconnected from the people, and they don't represent you. Because they take so much corporate money and billionaire money that they're only concerned with their interests. So even when the American people scream at the top of their lungs, we want this, doesn't matter. By the way, over 90% of the American people want universal background checks for gun purchases. Over 50% want a ban on high-capacity magazines. These are just moderate vanilla gun reforms that, even majority of NRA members support, and Republicans. But we don't get it. Because on that issue, the Republican Party is too busy taking money from the NRA and representing their interests. And remember, They're representing the leadership of the NRA, who take their money from gun manufacturers. So it's a corrupt system, because even the members of the NRA agree with us. So they're listening to the corrupt leadership of the NRA, who are bought and paid for by the gun manufacturers and gun sellers. So that's the way the system works. No money for things where everybody agrees we should spend the money. School, daycare, healthcare, but all the money in the world for the dumbest priorities.